Now live, good afternoon. I want to welcome you to today's VETgirl YouTube live event. Super excited to have Dr. Darren Berger here with us. We're going to be talking about canine atopic dermatitis, achieving Zen for pets and owners. And I love it. I'm looking at our screener, our question screener right now, and we have some of our stalwarts that are always here because they know what we're going to eventually ask is for you to type in where you're logging in from around the country and the world. We already have PA, California, Austin, where it's finally not super hot, Illinois. Oh my
goodness. For Portugal.
Please do it. Please do it. But we're going to talk about ourselves for a second while you do that. My name is Garrett Pachtinger. I'm the co-founder of VETgirl and a critical care specialist. And as I look out my window, I'm logging in from beautiful, sunny, a little cold Pennsylvania, but the leaves, oh boy, they're like fire red on the trees. It's gorgeous right now. Justine, where are you logging in from today?
Thank you everyone for being here. I am Justine Lee. I'm a criticalist and toxicologist and co-founder of VETgirl 2, and I am logging in from St. Paul, Minnesota, where it is warming up to 48 degrees right now.
I know. It's so cold. It was like 41 when I woke up this morning. Dr. Berger, where are you logging in from today?
I am logging in from beautiful, sunny Des Moines, Iowa, and I just happen to be a little bit more balmy 50 degrees, just being a couple hours south of Justine here today. So just a little warmer.
We love it. We love it so much. And please keep typing it in. Welcome, everybody. We still have Spokane, Montana. We love seeing where you're logging in from. So please keep doing it as we get through our VETgirl housekeeping, and we're going to keep moving forward. First of all, a huge shout out and thank you to Elanco. They're an amazing educational partner with VETgirl. And it's with their generous support that we're able to provide Dr. Berger's complimentary, free, race-approved CE to the veterinary world today. So again, thank you so much, Elanco, for being here with us today. Now, I did just say it is race-approved CE, so how are you going to get your CE certificate? Well, two ways. One is you can type into your browser tinyurl.com / and then VG for VETgirl, and then today's date, which is 10/16/24, or use your fancy smartphone and that QR code. It takes you to that same form to fill out. Now, it's about 12:03 Eastern. We're going to leave this form open for 30 minutes after the end of the session, 1 p.m. Eastern, so you don't technically need to do that now. I will type it into the little question screener a little bit later, but please go ahead and do that before 1 p.m. Eastern. And when you do, please make sure you use your VETgirl email address, the one that you log into your VETgirl online account with, so we can put your CE certificate directly into your My Credits page. And I see Justine just put that link into that screener for you. And because this is YouTube, we know sometimes that screen can be a little bit small. If you click on that open-sided box in the bottom right, it will make that YouTube video screen the entire screen of whatever device you are using, so you can see us in HD. That's what you want to see, right? Our pretty faces in HD and a slides Dr. Berger put together. If you're not familiar with VETgirl, I hope this is a great introduction for you. We really have a great option for all professionals. We offer a multimedia approach to education. So whether you're looking for webinars, YouTube Lives, which are kind of shorter webinars for us, podcasts, blogs, how-to videos, our certificate programs. We currently have, I think, 13 or 14 certificate programs now. We have a message board for a case consult. So if you're not a VETgirl member, check it out. We give you a 14-day free trial if you've never been on our platform before, but really it's a great cost-effective way to get your race-approved CE on your time. Whether it's 2 a.m. or 2 p.m., you can watch, listen, learn, educate, and really hopefully enjoy what you're doing each and every day. I also hope you've seen us. VETgirl U 2025. Oh God, I'm so excited. It's going to be in the amazing Nashville. I've been there a couple of times. I was there a couple of weeks ago. I'm going again in February. It is such a cool hit city. And we do sell out every year. So if you think you want to be with us in Nashville, I promise you, register sooner rather than later. Last year, we had 1,000 attendees and almost a 500-person waiting list. So don't delay. It's going to sell out. It does every year. And I hope to see you there. With that said, I know you're not here to listen to me today and or Justine. We're here to listen to Dr. Berger. So Dr. Berger, again, thank you so much for being here with us today. I'm going to drop myself out and Justine. And if you can give our audience a little bit of a background of who you are, what you love to do, and then please take it away. The floor is yours.
Yeah, well, thank you. I'm not sure anyone wants to see me in HD, but I appreciate the capability is there. Yeah, my name is Dr. Darren Berger. I'm a boarded dermatologist. have done general practice. I've done emergency work. I did a private practice residency out in Arizona, and then was a tenured professor for the last decade at Iowa State. During that time, I also had the opportunity to teach at the University of Minnesota and South Dakota State. So just a little bit about me. Glad to be here, but happy to kind of get talking about what we're going to talk about here today. And that's really Zenrelia. And this is a new drug. I know most people have probably heard about it at this point. We're going to tackle a few things head on. As you can see, we've gone ahead and put the box warning right up there. For those that weren't aware that that was on the product, it is worth noting that there is a box warning around Zenrelia for vaccine-induced disease and inadequate immune response to vaccines. Based on results of the vaccine response study, dogs receiving Zenrelia are at risk of fatal vaccine-induced disease and inadequate immune response to vaccines. And so with this, there is a discontinuation of the drug 28 days to 3 months prior to vaccination, and then 28 days after, holding it for 28 days after. So with that, let's kind of get on to a little bit of talking about the drug itself. And this is not a this or that conversation. This is really a this and that conversation. This is an additional option in that toolbox to help with some of those pruritic, itchy dogs with canine atopic dermatitis. Again, a new option given the lack or kind of the short amount of them that we've had up to this point. Now, what is it that Zenrelia is for those that really haven't seen the product or had a chance to use it? It is a Janase kinase inhibitor, has the same label indication that you're going to actually see with those that are familiar with Apoquel. So it's indicated for the control of pruritus associated with allergic dermatitis and also the control of atopic dermatitis in dogs 12 months of age or older. One of the big differences here is that it is dosed once a day and only once a day. There is no loading dose. There is no twice daily dosing. This medication is given once a day from the word go on, and it comes in 4 tablet strengths. Again, a 4-8, a 6-4, an 8-5, and a 15. And what you can see is that for those that have been familiar with using Apoquel, where you may see certain weight ranges end up in a dosing chart where you're maybe a half a 16 with a 5-4, or a 5-4 with a 3-6. What we actually see with this particular product, Zenrelia, is that the same tablet size is always being sent home regardless of that weight, that weight band. Now, as we start to kind of talk about understanding and understanding some of the field studies that are out there, we're going to talk about 4 of them here today. I'd actually encourage everyone to join us on Sunday evening, in which we'll have a bigger conversation around atopic dermatitis and actually present an additional study on Sunday night, a head-to-head clinical trial that was generated out of the European Union as part of that licensing process. And we'll go into that in some detail on Sunday night as well. But when we start to look at these studies and we start to look at efficacy, it really is kind of important to understand what is it that we're asking clients to measure? What is it that we're trying to measure? And really that is that of pruritus. And this is what's known as the pruritus visual analog scale. It's what you're seeing in the chart on your left, where you have a linear black line. The color coordinating on the left of that line, that's there for context. The clients actually don't see that, but you see the 6 descriptors on the right. The clients read that and then mark where they feel their dog's itch level is. It's a fairly nice validated score. And what we see is that it can correspond to certain states for the patient as well. Dogs scoring a 0 to 1.9 are really considered normal, while dogs generating a score over 5.5 are actually considered to have severe itching or severe pruritus. And a nice kind of side note about this validated scale is that when it was developed back in 2009, one of the things that kind of came out of that was this idea of, clients, when their dogs were treated, what did our clients anticipate? And the vast majority of clients actually expect their dogs to land at a score less than 2 following treatment. So again, our clients kind of telling us they really expect their dogs to be in a more normal state where maybe good enough isn't good enough for them. Now, as we start to try and look at Apoquel compared to Zenrelia compared to Apoquel, the easiest thing I think most people do is they go pull out the package inserts and they start trying to compare efficacy study to efficacy study. And the first thing that you have to understand with those efficacy studies is it's not an apples to apples comparison. It's more of an apples oranges comparison. And that's because the benchmarks have really moved over time after a decade of having Apoquel on the market. And during the initial clinical trials for Apoquel, what we see is what was considered kind of effective or considered the benchmark was a 2-centimeter reduction in this PVAS score. Subsequently, and with future medications coming to the market, that benchmark now has been moved to a 50% kind of reduction in the patient's itch, maybe a more meaningful kind of place to get. We could have a conversation, is 50% enough of moving the bar in those patients? But at least with a 50% reduction, we anticipate seeing something much more observable kind of in the client. And so when we look at that from a hypothetical standpoint, over a decade ago, when Apoquel was going through the development process, the target was if the dog had an itch, hypothetical, let's say an itch level of 10, that dog's itch level would have been reduced to 8, where the new benchmark in that same hypothetical situation would be that target would have to move from 10 down to a level of 5 now to actually show efficacy. And so that's really the new benchmark that we're kind of looking at. This brings us really to the first clinical trial that I want to present and talk about here a little bit, kind of going through the label a little bit with you. And that is really the first clinical trial looking at that of dogs with allergic dermatitis. Now, these are 306 client-owned dogs that were distributed in a 2-to-1 ratio, treatment to placebo. This was done at 15 different sites, 12 primary practices, and 3 derm clinics. Primary endpoint here was over the first kind of 7 days or 28 days, with a continuation phase out to 112 days to generate some more safety information. Dogs could be enrolled in this clinical trial with any allergic disease, but they had to have an itch score of greater than or equal to 6. So again, they had to fall in that. They had to have a classification of their itch being severe. They were treated with either lunocitinib or placebo. So lunocitinib, also known as Zenrelia, was dosed at 0.6 to 0.8 milligrams per kilogram, again, once a day, never twice a day, once a day with that, with standard washout therapies. And then patients being enrolled in this could be on concurrent medications, vaccines, parasiticides, anything that would have been considered standard of care during the course of enrollment. What we see is that dogs that were enrolled in this clinical trial, they were enrolled basically with the vast majority having a diagnosis of canine atopic dermatitis. They could have more than one diagnosis at the time of enrollment, but we see things such as contact allergy, which is a little striking, seeing the percent with which it's occurring, because we would consider that to be a little bit lower. We do see flea allergy dogs being enrolled, food allergy dogs being enrolled, and then another being thrown out there as other diagnosis. The most common breeds that were enrolled in this clinical trial were the Labrador, the Shih Tzu, or the Pit Bull. For those out there wondering, where is the Frenchie? We'll get to that. The Frenchie starts to make up a bigger population of a couple of the other studies that we'll talk about. And so with that, as we kind of start to look at what's considered efficacious for this, the benchmark here for this study was over the course of the first 7 days, there had to be at least a 50% reduction in the patient's pruritus as observed by their owner. And that had to occur 5 of the first 7 days, even if they missed 1 day of medication. And what we see over the course of that first 7 days, that 25% of the Zenrelia dogs are meeting that benchmark compared to only 8% of placebo, again showing quick reduction in pruritus. Rapid, significant reduction in pruritus at a much significant level between the drug and placebo, showing the drug to be effective in that scenario. As we look at that drug out over a period of time, we see continued reduction in that itch score. That's the graph to your right. We see the starting itch score for those dogs being around a 7-9 in terms of a mean level. That slowly and steadily decreases over the first 7 days to day 14, and then slow, steady progression again out. During the course of this clinical trial, there was also an investigator kind of skin score done, a similar type of visual analog scale, 0 being no lesions, up to 10 being pretty bad skin. What we also see over the course of that first 28 days from the investigators is that we see a halving of the skin scores, or a rough halving of the skin scores by day 7, and a 75% reduction in those skin scores looking at out to day 28. So again, seeing fairly rapid clinical improvement both in itch and skin scores in the allergic dermatitis study. As we start to kind of talk about and go on to the next clinical trial, another scale that's worth kind of noting and how are we assessing things, and that's the CADESI. The CADESI is a investigator objective scoring system. There's been several iterations of this. The one that is now being used is that of the CDC-4. We see similar types of breakdowns with the scores, but the max score a dog can get on this scale is 180. Anything over 60 is considered severe skin disease. Anything less than 10 is actually considered that of a dog that of a normal dog or a dog that may be in clinical remission of its disease. The images that you're seeing on the right is actually kind of the training or grading scale for what's being looked at. Those lesions are scored from 0 to 3, and the things that are looked at are erythema or skin redness, lichenification or that skin thickening, and then excoriations and alopecia are kind of used together as an assessment of self-trauma or self-licking, chewing, biting, scratching. And so this is that other objective scale that's going to kind of come into play as we start to talk here. The next study that we looked at, or the pivotal field trial that we looked at, is really that of the safety and efficacy for atopic dermatitis. This study enrolled 268 clinical client-owned dogs from 25 sites. In this case, it was 14 primary care facilities and 11 specialty practices. The primary endpoint of this study, again, was 28 days with a continuation phase out to 112. Unlike the prior study, these dogs actually had to have a diagnosis of atopic dermatitis, so that process of elimination, making sure we come to the right diagnosis, but then also had to fulfill another set of criteria to ensure that these patients were as appropriately diagnosed as possible. The dogs had to have, again, a severe level of itch, and they had to have at least mild skin disease. What we actually see is that the dogs had a significant level of itch, and almost the mean levels of the dogs in both groups were actually that of almost severe skin lesions when we look at what dogs were actually included. We had similar washout therapy. So again, these dogs couldn't be on cyclosporin, steroids, or receiving a monoclonal antibody. And again, they could be on concurrent medications during the course of treatment. We see very similar breeds that got enrolled. Again, the German Shepherd dog, the Pit Bull, the Lab, the Frenchie. This again starts to look a lot like my daily kind of clinical log in terms of patients coming in, with an average age of almost 6 years and roughly right around 23 kilograms in body weight. So again, matching what we very commonly see in clinical practice with regards to this. Now, when we start to look at that 28-day efficacy time point, what was really being shot for, what was being tried for, and that was that there had to be at least a 50% clinical reduction in the PVAS, the CDC, or both. And what we see is that 83% of Zenrelia-treated dogs had at least a 50% reduction in one of those or both, compared to 31% of placebo, and that was statistically different between the two groups. Again, showing the efficacy of the medication for treating dogs, both their skin and itch associated with atopic dermatitis. Additional things that were looked at over the 112 days that we see is just an overall greater response to treatment as a whole, as judged by both clinic owner and investigator response to treatment scores. Overall, the proportion of dogs who got to a greater than 50% reduction in those scores, the overall means of those scores over time, and then we just see this slow, steady, continual decrease out over the 112-day period. With regards to what would we expect from adverse events, what does the safety profile of this drug looks like? From the clinical field trials, the pivotal clinical field trials, it looks very similar to what we've all come to anticipate with that Apoquel. The most common reported adverse events are going to be that of GI upset, so vomiting, diarrhea, anorexia. We'll see some lethargy. We'll have rare dogs that are going to have elevated liver values. You'll have the occasional dog that may have some changes to their red or white blood cell count numbers. But again, as we look through those adverse reactions, very similar. Now, the one thing I would say is that if you're pulling out label to label and looking at the exact rate percentages, realize how these adverse events are recorded. You're going to have the clients have a daily journal that they're recording observations that they see. When we look back at when Apoquel was originally done back in 2009 to 2011, think about what you and your clients were doing versus When the Zenrelia clinical trials were being done, that of 2020, think about what you and your clients were doing that year. I definitely got more busy because my clients were sitting around paying a lot more attention to their dog. And you can see that a little bit, what I would propose a little bit when you look at the overall rate of the placebo reactions. Again, we have a client base that was a little bit more hyper-acute, hyper-aware with regards to that during the documentation kind of phase. Now, as we start to go into this and we start to go a little bit further, I do want to talk about two of the safety studies that I think are worth noting. The first is the margin of safety study. This is a study looking at laboratory beagles that get dosed at various different doses, whether it be labeled dose or exaggerated dosing, all the way up to 5 times the labeled dose on a daily basis for up to 6 months. During the course of that 6 months, all dogs completed the clinical trial with no serious adverse reactions. There were some treatment-related effects with regards to, at the higher doses, we see some interdigital papillomas. You also see interdigital dermatitis and furunculosis. Again, the way the animals are housed and the elevated doses, the higher the dose, the more pronounced those lesions became. One dog in the 3X group had a Demodex mite found on biopsy, no overt clinical symptoms of demodicosis. And then we do see an overall decrease of prostate gland weights in the male dogs that were enrolled in the study, and then a dose-dependent decrease in red blood cell parameters that is very pronounced at the 3 and 5X dose at the much higher elevated dose. What we don't see are treatment-related effects around lymphocytes, monocytes, and basophils. And it's really this margin of safety study, even at these exaggerated off-label doses, that support the safe use of Zenrelia at the labeled dose for the treatment of dogs with pruritus or atopic dermatitis. In addition, results are very similar to what you see in the Apoquel margin of safety study. A slight more effect on red blood cells in ours, a slight more effect of white blood cells in theirs, but all in all, very, very similar with respect to what is seen during the course of those margin of safety studies. The next thing that I think most people have questions around, and we're going to tackle really kind of head on here, is that of the vaccine response study. This is a study that looked at 10-month-old pathogen-free dogs. The dogs were to have absolutely be free of all pathogens. These are dogs that are purpose-bred, have not been exposed to anything, never received vaccines. The dogs were broken into 2 groups. 8 of them got no medication or got a placebo. The other 8 got 3 times the labeled dose, 8 dogs per group. And then dogs were vaccinated at day 28, day 60, and then titers were checked at day 88, and again at day 116. During the course of this clinical trial, 2 dogs were euthanized, one with hepatitis and pancreatitis, another with GI and a little bit of a septic event. Very similar in terms of the number of dogs that were euthanized during the part of the study compared to that what we see with Apoquel during the phase of that. One of the dogs with regards to that, we'll talk a little bit more in depth here in a minute. But when we look at response to vaccines in the remaining 6 dogs on 3 times the labeled dose, we see that all 6 dogs mount a response to parvo, all 6 dogs mount a response to adenovirus, 5 of 6 mount a response to distemper, and 2 of 6 mount a response to rabies. Following removal of the medication and checking at day 116, all but 1 dog has mounted an adequate titer response. That is the same dog that doesn't mount a response to the distemper vaccine. Now, when we look at the overall part of this study, there are some confounding things that are worth having a conversation about. The first is that the dogs did have coccidia. Again, they're supposed to be pathogen-free, but we know dogs with intestinal parasitism can have a decreased response to rabies titers. Secondly, that dog with liver disease had internuclear inclusion bodies and pathology very consistent for canine adenovirus 1 or infectious canine hepatitis. That is different than CAV2, which is found in the modified live virus. Additionally, if you remember when we talked about the 5-time labeled dose for 6 months, we couldn't really affect the lymphocytes. We see some interesting changes in the lymphocytes, specifically the T helper subset, during the course of this study, where both the placebo dogs and those dogs that were treated with Zenrelia had a significant reduction in their T helper cells. And we know that T helper cells are vital for mounting a titer response to the vaccines. Now, when we start to talk about the vaccine response study and what does it really mean for us, we do have this hold period of at least 28 days before and 28 days after. But where is that really not relevant? And we start to think about those dogs that are on 3-year vaccines, the dogs that have short seasons, the dogs being treated for a hotspot, the dogs being treated maybe for very short seasonal disease. And so, again, many scenarios where that vaccine or what the box warning is speaking to are not necessarily relevant in the patients that we're treating. Now, having talked a little bit about that, just kind of want to sum up here a couple of things and leave a little bit of time for questions. When we look at the overall safety, the safety label warning comes from that margin of safety study and the various different field studies that have been done. The box warning relates to those 8 dogs in the vaccine response study. It does not relate or is relevant to the other safety studies that we've presented and really kind of talked about here. Now, what I think is a little bit more, again, kind of ending on a different way when we look at this, really is when we start to think about, that margin and what it is that we're really looking for in patients. To me, it's not just how many are we getting 50% better. The question is really how many dogs are we getting back to a normal state or what we would kind of define as clinical remission. And that really is when we look at the dogs in the allergic dermatitis study, those dogs that achieved a score of less than 2, again, that normal state. We see at day 28, 51% of those dogs got normal scores. And at day 112, up almost to 80% of dogs had achieved a itch score of less than 2 in the dogs being treated with Zenrelia. When we look at that atopic dermatitis study, we see that, again, 33% of dogs at day 28 have skin lesions that are consistent with normal dogs compared to 0% of the placebo dogs achieving that. When we look out to that continuation phase out to 112 days, we see that 67% of dogs have normal skin scores and 67% have a normal itch score. Again, very promising and encouraging when we start to look at that. Now, where does that really leave us? And kind of, again, trying to leave some time for questions here. Again, Zenrelia once daily dosing was effective in alleviating clinical symptoms of allergic dermatitis and canine atopy. Had a very similar adverse event profile to what we have come to expect with Apoquel. There are some subtle differences, but again, overall quite similar. The continuation phase of these pivotal field studies really revealed some promising results for the potential of clinical remission in both lesion and pruritus scores in these patients. And then again, potential case considerations where the box warning really is not a consideration for us. Again, that acute pruritus, the patient presenting with fleas, hot spots, maybe during, for those dogs, again, with flea allergy dermatitis, or maybe in the initial phases of the diet elimination trial, those dogs with seasonal, very, very seasonal disease, or those dogs that are failing other medications where we're now starting to do off-label combo therapy or off-label chronic therapy. Again, this may be a nice consideration for those patients. And so with that, happy to entertain some questions here. Again, I appreciate you for joining us, but I strongly encourage you to join us on Sunday when we'll have more time to dive into some of this in greater detail. And again, going to discuss and share those results of the head-to-head clinical trial that was done over in Europe.
Awesome YouTube Live. Thank you so much, Dr. Berger. Really appreciate it. Again, just also wanted to reiterate a huge thank you to Elanco for sponsoring today's free YouTube Live event and Sunday's webinar. So if you want to hear more, which you need to hear, make sure to tune in. It's going to be 8 o'clock Central Time, 9 o'clock East Coast time. And we did a little bit later just to make sure the rest of the West Coast can hear it too. So make sure to sign up for that. You can find more information on our website. All right. So I definitely see a couple of questions out there that I wanted to address. Before I forget, please make sure, I know Garrett just posted the QR code. Make sure to fill out that form, tinyurl.com, because you have to register with the email address associated with your VETgirl account, even if it's your free VETgirl trial account. Otherwise, you won't get your CE certificate. Okay, you'll find it in my credit section. All right, I see a great question. Is there any concern, Dr. Berger, on neoplasia or infection by using Zenrelia as prescribed versus, I can never pronounce it, so I'm going to say Atopica. Has there ever been any reports of that you know of?
So again, what we see, great question, by the way, but with this is a question that commonly comes up around the Janase kinase inhibitors as a whole, and we'll speak to both Apoquel and Zenrelia. At this time, with the drug that's been on the marketplace for over a decade, clinical trials looking at the rate of potential neoplastic disease really has not shown that dogs with atopy being treated with a Janase kinase inhibitor over time are any more likely to develop a tumor than the same breed with atopy, the same sex of that breed with atopy over time as well too. So again, no breed specific, no disease state specific increased rates of neoplasia over time, really with either one of those medications that were mentioned. Again, Zenrelia just coming to the market in the last couple of weeks. You're going to see language on any Janase kinase inhibitor that comes to market that will have a neoplastic warning label. And again, I think the question around the deep infections, right? Like this is not a drug I would be starting a dog up on that maybe I'm treating blasto or maybe has valley fever out in the Southwest. Maybe you're from another geographic location, and I've caught some others, maybe a dog that's recently diagnosed with leishmaniasis, or maybe a dog that's got some sporotrichosis again, from it looks like some of our Central American pals as well too. Like those are deep fungal infections where I would not be starting immune modulatory medications simultaneously until I got those diseases under better control. If the dog were still paritic for another disease, that then may be appropriate. But I hope that broadly answers that question. It could be very specific given the location that someone's asking that from.
No, that's fantastic. Thank you so much for answering that. You know, it's so great to have, again, one more tool for paritic dogs. You and I, Darren, we're from the same vintage, so it's nice to have more than just spread or steroids, right? And we've talked about that before. Now, I know, having done some FDA reporting before, most drugs aren't tested with other drugs. So somebody wants to know, any study on simultaneous use of Zenrelia with other common drugs used in our itchy patients, such as glucocorticoids, Atopica, essential fatty acids, anything like that we know of?
So to date, when we talk about the other paritic medications, i.e. glucocorticoids, Cytopoint, cyclosporin, those medications, there are no concurrent trials that have looked at the simultaneous use of those medications in a patient. Those would be off-label use of the medication at this time. With regards to essential fatty acids, there are definitely patients during a number of the pivotal field trials, both the two done here in the US and the one done over in Europe, where patients were receiving fatty acids during the course of treatment. In terms of the effect that had, the small subset, I can't tease those out or talk to that specifically, but they definitely received those at that time.
Wonderful. All right. I see another question. We're not going to talk about pricing because it's going to vary across country, but there is one question based on what you were mentioning about vaccines. So Zenrelia is to be discontinued pre and post-vaccine. Any medication we can safely use to control those patients without interference with vaccine response?
That's really a great question. This is a question that's going to commonly come up around the medication itself. You know, recommendations at this time would be really kind of twofold. Either the potential use of a monoclonal antibody such as Cytopoint, which is likely to interfere with its mechanism action less on an overall immune response. The alternative to that is low-dose anti-inflammatory pred. Think 0.5 mg per kg every other day. Again, not daily, but low. Again, realize that these guidelines and that kind of hold time frame are also generated and extrapolated from the withdrawal time of immunosuppressive doses of steroids around WASAVA vaccine guidelines. So again, where are those time frames coming? Where are they being pulled from? They're being extrapolated from that. And again, the 28-day time frame is coming from that time point of day 88 to 116. Where we see the drug actually being discontinued for that 28 days and then the titers being remeasured.
All right. And just for the sake of everybody's time, we'll take one more question. But again, I wanted to give a huge shout out, Dr. Berger, that was amazing. And also a huge shout out again to Elanco for sponsoring today's YouTube live event. Don't forget, this Sunday, I don't even know what day of the week it is. I think it's Wednesday, in a couple of days on Sunday at 8 p.m. Central Time, 9 p.m. East Coast Time. Dr. Berger will be taking a deeper dive into this. So if you have questions, you definitely want to tune in because you need to know this new drug, right? Your clients are going to ask about it. So make sure to tune in on Sunday. And again, that will be totally free. Thanks to sponsorship from Elanco. All right, we do have one last question, and to me, it's probably study design related, but there was one question about, and this gives me flashbacks of when the Meropitant study came out and the puppies in the study ended up developing parvo, and it changed the labeling. But how are dogs with coccidia enrolled in the vaccine study? Were they screened, or do you know any of the details behind that?
So great question with regards to this. Again, coccidia, whether or not it was picked up during the transport from the breeding facility to the testing facility. Again, was it a latent infection that was within the dogs that wasn't picked up during screening? In terms of were PCRs run or anything like that prior, I apologize. I would like to speak to that in more detail than I can really freely probably speak to here at this point with regards to screening. But it's also not uncommon for dogs in these clinical trials, these beagle breeding colonies, to actually have either coccidia or giardia at a subclinical level that then becomes relevant during the course of the stress of transportation or stress associated with the trials. But again, I don't want to misspeak around that to say exactly what was every step of the screening process. But again, we can assume that during entry, there was nothing being picked up on at entrance into the clinical trial.
Awesome. Thank you so much. That's so helpful. I always say, when in doubt, you could always pull the Freedom of Information Act or actually read the brochure that comes in there that nobody reads, the pamphlet. So when in doubt, check that out. Dr. Berger, awesome information. Totally appreciate what you do. And looking forward to hearing you talk in 4 days on Sunday. Again, when in doubt, check that out. And I really encourage everyone to attend, including your veterinary staff, your veterinary technicians, because again, it's National Veterinary Technician Week, and you should at least give back with free CE. So shout out to all the amazing vet techs out there. Dr. Berger, we'll see you on Sunday. And thank you again so much.
We'll have cocktail hour on Sunday evening.
Love it. Love it.